A Minnesota state senator says officials are asking doctors to fill out death certificates with diagnosis of COVID-19, whether the person died of it or not. Valley News Team's Callie Hubbard talked to the lawmaker today, who says fear may be coming into play.
Minnesota Senator and Dr. Scott Jensen says he received a 7-page document from the Minnesota Department of Health on how doctors should go about filling out a cause of death certificate. The letter from the Minnesota Department of Health gives advice to physicians, physician assistants, and others who certify deaths. The doctor says the letter takes you to a CDC website that has recommendations on how to include COVID-19 as a diagnosis for someone who was never tested for COVID-19.
Say I have a nursing home patient who's frail and 88 years old and comes down with a cough and a fever, and after 3 days ends up passing away from pneumonia. I'm not going to put influenza on that death certificate. So I doubt that I would be inclined to put COVID-19.
Dr. Jensen says each state's reported death numbers are making a lot of people fearful, adding that getting the number right is critical, especially during a pandemic.
I worry that sometimes we're so darn interested in just jazzing up the fear factor that sometimes people's ability to think for themselves is paralyzed if they're frightened enough.
One of the scenarios listed under the CDC guidance for certifying deaths due to coronavirus says, although no testing was done, the coroner determined that the likely underlying cause of death was COVID-19, given the patient's symptoms and exposure to an infected individual. So is the Minnesota state data reliable?
I don't think I have any position to question that per se. I know that I have talked with nursing staff who have been involved with people who have passed away that had either living wills or were on hospice care. In some of those situations, I've been led to believe that there may have been a COVID-19 diagnosis included on the death certificate document without having had a COVID-19 confirmed laboratory test, but I don't have any way to confirm that myself.
He says the public isn't stupid, and if you start messing with numbers, you're going to wish you didn't. In the FM area, Callie Hubbard, Valley News Live.
To stay up to date on those latest numbers yourself, download our Valley News Live app.
You just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
Have you yet seen the information that's going into these U of M models that the governor is using to make these decisions?
No, we have not. We have asked for those, and we were told by the governor's office that we would receive the data tonight. And so we're hoping to see what the assumptions are and what the data is. But at this point in time, we have not.
So I just want to be clear for our audience, sir. You've got a governor of a state that is making executive orders, stay-at-home orders, that right now is cratering your economy. We don't know what data is being used, and yet you as a state senator, as a doctor, have not seen that data that's being used for our governor to make these decisions.
No, we have not. And
does that not concern you? I mean, shouldn't the people of Minnesota be screaming right now?
Well, I think, Minnesota nice. We want to be good soldiers in that, but I think that people are starting to say, hold it now. We need to have a deeper understanding of this, and we're not getting it. I think that, in Minnesota.
My question for you is: anybody asking him, how in the world did you come up with 74,000? Where did you get that number from, and who determined what data was actually going into the model to say, hey, we could lose 74,000 Minnesotans? Now, here's what you need to know. He got that model that was from a place that was created by the University of Minnesota and the Minnesota Department of Health. Again, tonight, question everything. Ask questions. Let me ask you this. Here's some questions to think about. Who funds the University of Minnesota? Who paid for this model that's creating all this data? That would be you, the taxpayers, by the way. How much did this model cost that's being created out of the University of Minnesota? And also, why isn't Minnesota using the same models or the IHME models like the rest of the country's using, including the White House, especially when they're making executive stay-at-home order decisions that are really decimating the economy? Now, to be fair, the numbers could be completely accurate. The problem is we don't know. You're the taxpayer paying for this model, giving the governor the data that he's using and the power to do an executive stay-at-home order that is cratering your economy right now, and yet you don't really know what the data is that's driving these kind of decisions. I asked Minnesota State Senator and Dr. Scott Jensen last night on Point of View about this. Here's some of our exchange. Have you yet seen the information that's going into these U of M models that the governor is using to make these decisions?
No, we have not. We have asked for those, and we were told by the governor's office that we would receive the data tonight. And so we're hoping to see what the assumptions are and what the data is. But at this point in time, we have not.
So I reached back out to Senator Jensen today to see if he'd seen any of the data for the models yet. He still has not gotten the information. He is a Minnesota state senator and a doctor, still no data. So the state of Minnesota, guys, you're allowing the governor to basically shut down your state, your life, your businesses, and yet you haven't seen the data that's actually driving his decisions. Please question everything. By the way, we here at Valley News Live have filed open records requests to the governor's office to get this information for you. We'll let you know if and when we get it. Also, from Minnesota Governor Tim Walz's presser today, Minneapolis reporter Tom Hauser tweeted this. I remember, 74,000. Here's what he tweeted out. Minnesota Health Commissioner Jan Malcolm says the Minnesota projection model now shows 6,000 to 20,000 deaths in Minnesota. We just shaved off 54 there. She acknowledges other models show far fewer. In fact, the University of Washington model, the one we just talked about, the IMHE model, shows 456 deaths in Minnesota by August 4th. 456, 74,000. Question everything. Also on last night's show, Senator and Dr. Jensen said something that has now been seen on social media. Listen to this, folks. The interview I did with him last night has now been seen on social media well over 500,000 times. And what came up in this conversation is the fact that the Minnesota Department of Health is inflating the number of COVID deaths. Please listen closely to this exchange I had with Senator Jensen on last night's show. What you just said, I think, is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people, and I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough.
What he just said there, folks, is spot on. That's why I'm asking you, I'm encouraging you, I'm challenging you tonight. Question everything. With what's happening right now, there's a lot of fear and trepidation. I get that, but it does impact our ability to think critically. He just said, hey, one of the reasons that they're inflating COVID-19 deaths, the possibility, is fear, as he just said. But I want to ask you this. Why do you at home think they're inflating the number of COVID deaths in Minnesota? I've been asking a lot of people that question today. One of the things that we've also been talking about is, hey, do states maybe get more federal dollars if they label a death as a COVID death now? Because, again, this is an emergency. I did reach out to Senator Kramer and Congressman Armstrong's office earlier today to find out more about the CARES Act. That was the $2 trillion bill they passed for this COVID emergency situation. I have not heard back from them yet. But then I did some research and found this on the Kaiser Family Foundation website. Thanks to Tori as well. I'm going to read this for you. It might be a little bit hard for you to see at home, but I'm going to read for you what it says here about $100 billion for hospitals that it's in the CARES Act. Please listen closely. The $2 trillion Coronavirus Aid, Relief, and Economic Security CARES Act contains a vast array of spending provisions, including an additional $100 billion for the Public Health and Social Services Emergency Fund. The new funding is designed to provide an influx of money to hospitals and other healthcare entities responding to the coronavirus pandemic. This $100 billion averages out to about $108,000 per hospital bed in the United States. It goes on to say nonprofit and for-profit hospitals may be eligible for funds, and potentially other entities may receive funding if they diagnose, test, or provide care for COVID-19 patients. It's a possibility. Also, I was going to wrap this up myself, but I love what Senator Jensen said at the very end of the bit I was playing for you there earlier. Here's how he finished it.
And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Amen to that, my friends. Folks, those are just two examples I want to share with you as why you need to be questioning everything that you're seeing right now. Again, all of it could be accurate. I'm just asking you to think critically and question everything, and that's tonight's point of view. Would love to know your Laura Ingraham show last night, and you had alluded to maybe there were some financial purposes or financial reasons to inflate the COVID-19 deaths. She just said at the end of that conversation there that I played for our audience, there's no policy and no politics that would cause anyone to want to inflate those numbers. What say you?
Again, buy into that. I think we're going to have hospitals shut down and potentially never open their doors again. This is serious business. We might have the big metropolitan healthcare systems getting big chunks of money from the feds, but the bottom line is your outer ring hospitals and your hospitals out in Minnesota that aren't critical access, they're at risk. So I think that I would rather have people draw their own conclusions. Let me just say this. If I admit a patient to the hospital and they're on Medicare and they have just routine pneumonia for a diagnosis, the hospital will get a lump sum payment called a DRG, and it'll be about $4,600. If I admit that same patient and I attach COVID-19 to the pneumonia diagnosis, then it goes from $4,600 to $13,000 for that admission, regardless of whether the patient's in a hospital for 3 days or 13 days. If during that hospitalization, I put the patient on a ventilator for a period of time, then the payment goes from $13,000 to $39,000. Now that's a big payment. You're not going to see many outstate hospitals get access to those kind of dollars. When you start talking about these things, then I think people can understand the context of how critical this is, that it isn't a fair playing field. And we've got hospitals in outstate Minnesota that are not going to get the same kind of attention or monetary support.
Senator, I want you to, you're on the night making a big statement. You said there could be some hospitals that could shut down. Where specifically, how, and why?
Basically, if you're a critical access hospital in outstate Minnesota, you can get some bumps in your payment from Medicare. But if you're not a critical access hospital, if you're in Alexandria or Fergus Falls or Winona or Olmsted and Rochester or Ridgeview and Waconia, I think Lakeview Memorial and Stillwater, these hospitals aren't going to get that bump, and they are hemorrhaging today. They are laying off nurses. I think one hospital has 100 beds capacity. I think right now they have 20 or 25. They have 20 ventilators. None of them are in use. This surge that we're hearing so much about is going to be managed. And I think at some point in time, we could stop trying to cause people to be frightened to death about this surge. We're going to manage it. We probably have ventilators that will never even get unwrapped.
Senator, I got two more. Doctor, you're a senator. Let's say Governor Wallace happens to see this interview. What's your message for him?
Thank you, Chris. I appreciate that opportunity. I would say transparency. Governor Walz has spoken about transparency for the last 2 years. This is your time. Show us the modeling. Show us the data that's being fed into it. Show us the assumptions. Tell us why your modeling, the model you've chosen, is better than the other 50 that are out there. The Washington State model, the IHME, that model is totally different than what you're predicting. They're not predicting thousands and thousands of deaths. They're predicting 450 deaths by August 4th. And by the way, in 2018, there were approximately 440 deaths from the flu in Minnesota. And if the IHME model ends up being correct, that would be about on par. Wow. And I would say to Governor Walz, we're rooting for you. We want you to succeed, but please be transparent.
Yes. Last question. If he does, your message to President Trump would be what?
President Trump, you're not wrong to bring up hydroxychloroquine and azithromycin as hopeful measures for the future. And you're not wrong to talk about convalescent plasma as being a potential real lifesaver. You're right. You're leading. What you're doing is you're giving hope to the millions and millions of Americans that are looking to you for hope. You're not doing the fear mongering. You're just being a guy. You're being a guy who's telling us, hey, we're going to get through this and there's hope. And I thank you for that leadership.
Well, fear is a great way to control people. And I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough.